There's a strange kind of side effect that almost never gets reported to a doctor, because the person experiencing it doesn't even realize it's a side effect. They just think it's age catching up with them. If you, your parent, or anyone you love takes Amlodipine, Losartan, or Lisinopril for blood pressure, I want you to stay with me for the next few minutes, because today we're going through 6 specific things these medications can do to the body, things that are well known in medical literature, yet rarely explained clearly during a routine appointment. Let me be upfront about something important before we start. These 3 medications are not dangerous. They are among the most prescribed, most thoroughly studied blood pressure treatments in the world, and for the vast majority of people, the benefits, protecting the heart, the kidneys, the brain, far outweigh the risks. Nothing in this video is meant to make you afraid of your prescription or suggest you stop taking it. What this video is meant to do is help you recognize when something your body is experiencing might actually be connected to the medication, instead of being silently filed away as just getting older. Because here's the pattern that shows up again and again. A blood pressure reading looks excellent on the chart. The doctor is satisfied. The appointment ends in a few minutes. And the person walks out, goes home, and quietly deals with fatigue in the afternoon, dizziness when standing up, swelling around the ankles, or a cough that won't go away, without ever connecting any of it back to the small pill they take every morning. So today, 6 side effects. Some are common and frequently dismissed. Others are rare, but serious enough that everyone taking these medications should know the warning signs. By the end, you'll have a clear list of questions worth bringing to your next doctor's visit, questions that take 2 minutes to ask but can meaningfully change how your treatment is managed. Side effect number 1, swelling in the ankles and lower legs. This is one of the most common effects associated with amlodipine specifically, and it's also one of the most frequently brushed aside as harmless. Here's the actual mechanism behind it, because understanding why it happens makes it much easier to take seriously. Amlodipine belongs to a class of medications called calcium channel blockers. It works by relaxing the smooth muscle and artery walls, allowing them to widen and let blood flow through with less resistance. The problem is that it doesn't widen the veins to the same degree. That imbalance causes fluid to leak out of small blood vessels and collect in the surrounding tissue, most noticeably in the feet and ankles, where gravity pulls fluid downward throughout the day. In a younger body, circulation often compensates for this fairly well. In an older adult, particularly someone who already sits for long stretches or has reduced circulation in the legs, that fluid buildup can become more pronounced. Tight shoes, visible puffiness, sometimes mild discomfort or skin changes over time. Many doctors will tell you this kind of swelling is a known and generally harmless effect of the medication. And in most cases, that's true. But common doesn't mean it should be ignored. Persistent swelling can affect mobility, and reduced mobility over time can affect balance and overall circulation. If swelling is new, getting worse, or changing how you move through your day, it's worth a direct conversation rather than quiet acceptance. There are usually simple solutions: adjusting the dose, trying a different medication class, or combining lower doses of 2 medications instead of a higher dose of one. Side effect number 2, a persistent dry cough. This one is specific to Lisinopril and the broader class of medications it belongs to, called AC inhibitors. It tends to show up weeks or months after starting the medication, and it's easy to mistake for something else entirely: a lingering cold, seasonal allergies, even early concern about something more serious. The mechanism here is well documented. ACE inhibitors work by blocking the enzyme responsible for producing a hormone that narrows blood vessels. As a side effect of that process, a substance called bradykinin builds up in lung tissue. Bradykinin irritates the airways, and the result is a dry, tickling cough that doesn't respond to typical cough syrups or allergy medication. Because it isn't caused by infection or allergens, it's a direct response to how the medication works in the body. For an older adult, a persistent cough isn't just inconvenient. It can disrupt sleep, trigger brief dizziness during coughing fits, and generally wear down quality of life in a way that's easy to underestimate. If a new, unexplained cough develops after starting an AC inhibitor like Lisinopril, that connection is worth raising directly with a doctor. In most cases, switching to an ARB, such as Losartan, resolves the cough completely, since ARBs work through a different mechanism that doesn't involve bradykinin buildup at all. Side effect number 3, elevated potassium levels. This is one of the side effects that almost never produces obvious symptoms, which is exactly what makes it worth knowing about. Both ARBs, like Losartan, and AC inhibitors, like Lisinopril, can raise potassium levels in the blood, a condition called hyperkalemia. Here's why it happens. These medications reduce the activity of a hormone called aldosterone, which normally signals the kidneys to release excess potassium from the body. Less aldosterone activity means the kidneys hold on to more potassium than usual. On its own, this is often manageable. But combine it with the natural decline in kidney function that comes with age, and then add a diet rich in potassium: bananas, leafy greens, potatoes, beans, all genuinely heart-healthy foods, or a salt substitute that swaps sodium for potassium chloride, and potassium levels can rise higher than anyone realizes. The reason this matters so much is that elevated potassium often causes no noticeable symptoms until it begins affecting the heart's rhythm. That's exactly why periodic blood testing exists for anyone on these medications, to catch the number before it becomes a problem, not after. That's 3 side effects down, and we've still got 3 more to go, including one tied to a blood pressure reading that can look completely perfect on paper while quietly increasing the risk of a fall, and another that has almost nothing to do with the medication itself and everything to do with what else is sitting in the medicine cabinet. Let's pick up right where we left off, because the next side effect is one I think deserves more attention than almost anything else on this list, partly because it involves a number that looks like a complete success story on paper while quietly creating a real physical risk. Side effect number 4, a sudden drop in blood pressure upon standing, known as orthostatic hypotension. Here's a scenario worth picturing. Someone has their blood pressure checked at a routine visit. The reading comes back excellent, right in the ideal range, exactly what the medication was meant to achieve. The doctor is pleased. The appointment moves on. What rarely gets checked in that same visit is what happens to that same person's blood pressure the moment they stand up. This matters more than it might seem. When blood pressure is brought down effectively by medication, the body still needs to be able to compensate for sudden changes in position, like standing up from a chair, getting out of bed, or rising after kneeling in the garden. In an aging body, blood vessels don't always constrict quickly enough to keep blood flow to the brain steady in that first second or two of standing. The result is a brief but very real dip in blood flow to the brain, which shows up as dizziness, sometimes blurred or dimmed vision, and a few seconds of feeling unsteady on the feet. That brief window of unsteadiness is exactly when falls tend to happen. And in an older adult, a fall isn't a minor inconvenience. It can mean a fracture, a hospital admission, and a recovery process that affects far more than just blood pressure control. This is why blood pressure guidelines for older adults have increasingly shifted away from a single universal target and toward individualized goals that take fall risk, frailty, and overall health into account, rather than chasing the lowest possible number for everyone, regardless of age. The practical takeaway here is simple and worth repeating. Ask for blood pressure to be checked both sitting and standing, not just seated. A reading taken about a minute after standing up can reveal a drop that a seated reading alone will never catch. If dizziness on standing has become a regular occurrence, that's worth describing clearly to a doctor, not as a vague complaint, but as a specific pattern. This happens when I stand up quickly, or this happens most often in the morning. That kind of detail helps a doctor figure out whether the dose or the medication itself needs adjusting. Side effect number 5, fatigue, low energy, and what's sometimes described as brain fog. This is probably the most underrecognized side effect on this entire list, simply because it overlaps so heavily with what people expect aging to feel like. Feeling more tired in the afternoon, needing more rest than before, finding it harder to concentrate for long stretches. All of this gets absorbed into the general idea of slowing down with age, when in some cases it may actually be connected to how the body is responding to blood pressure medication. There are a few reasons this can happen. When blood pressure is lowered, blood flow throughout the body, including to the brain and muscles, decreases somewhat as well, even when it remains within a perfectly normal and healthy range. For most people, the body adjusts to this without any noticeable effect. But for some, especially when a dose has been increased or combined with another blood pressure medication, that adjustment period can bring a real sense of low energy, sluggishness, or difficulty focusing that wasn't there before. This is genuinely tricky to untangle because fatigue has dozens of possible causes. Poor sleep, low iron, thyroid changes, depression, and yes, normal aging are all real possibilities too. That's exactly why this isn't something to self-diagnose or assume is automatically the medication's fault. The right move is to mention it clearly and specifically. I've noticed I feel unusually tired since starting or increasing this medication, and I'd like to understand whether that could be related. That single sentence opens the door to a doctor actually investigating the timeline, checking other possible causes, and considering whether a dose adjustment might help, rather than the fatigue being quietly absorbed into, well, that's just what happens as we get older. Side effect number 6, interactions with other medications and supplements that change how these drugs behave. This last one isn't really about Amlodipine, Losartan, or Lisinopril doing something unexpected on their own. It's about what happens when they're combined with other things a person is taking, often without realizing the connection. A few examples worth knowing. Common over-the-counter pain relievers from the NSAID family, like ibuprofen or naproxen, can reduce the effectiveness of blood pressure medications and, in some cases, put extra strain on kidney function when combined with an ACE inhibitor or ARB. Potassium-containing supplements or certain salt substitutes can compound the potassium-related effect we talked about earlier. Some antidepressants and certain cold and flu medications containing decongestants can also interact in ways that either raise blood pressure back up or amplify a medication's effects more than intended. None of this means every supplement or over-the-counter product needs to be avoided. It simply means that blood pressure medications don't operate in isolation, and a full, honest list of everything being taken. Prescriptions, over-the-counter products, vitamins, herbal supplements, all of it, gives a doctor or a pharmacist the full picture needed to catch a problematic combination before it becomes one. A genuinely useful habit here is bringing an actual list, or even the physical bottles, to appointments, rather than trying to recall everything from memory. Pharmacists, in particular, are an excellent and often underused resource for this kind of interaction check. Many will happily review a full medication list and flag anything worth discussing with a prescriber. So that's all 6. Swelling that gets dismissed too quickly. A cough that gets chased through the wrong specialists. Potassium that quietly climbs without symptoms. A blood pressure reading that looks perfect while increasing fall risk. Fatigue that gets written off as simply getting older. And interactions hiding in a medicine cabinet that nobody thought to mention. None of these 6 things are reasons to stop a medication or panic about a prescription. They're reasons to ask better questions. And in the final part, I'm going to give you a simple list of exactly what to ask at your very next appointment, along with how to put everything we've covered into one clear, practical takeaway. We've gone through all 6 side effects now, so let's bring everything together into something genuinely useful. A short list of questions worth bringing to your very next doctor's appointment. None of these take more than a minute to ask, and every single one of them can meaningfully shape how your treatment is managed going forward. Question 1, why was this specific medication chosen for me and not a different class? Whether it's Amlodipine, Losartan, or Lisinopril, there's usually a clear reason behind that choice. Maybe it works well alongside another condition. Maybe it avoids a particular interaction. Understanding the reasoning, even briefly, helps you feel like an active participant in your own care rather than someone simply following instructions. Question 2, can my blood pressure be checked standing, not just sitting? As we covered, a seated reading only tells part of the story. A standing reading taken after about a minute can reveal a drop that explains dizziness, unsteadiness, or near falls that might otherwise go unexplained. Question 3. When was my potassium and kidney function last checked, and when should it be checked next? If it's been a long time, or you genuinely can't remember, that's worth flagging directly, rather than assuming someone else is tracking it. Question 4. Is my current blood pressure target appropriate for my age and overall health? This isn't a question to be afraid of asking. Most doctors welcome it because the right target really can look different depending on age, other health conditions, and individual risk of falls. Question 5. Have I mentioned everything I'm taking, including over-the-counter medications and supplements? Bringing an actual list, or the bottles themselves, makes this conversation far more accurate than trying to recall everything on the spot. Question 6. Have I noticed any new symptoms since starting or changing this medication? Swelling, a cough, unusual fatigue, or dizziness when standing? Saying this out loud, clearly and specifically, is often the single most useful sentence in the entire appointment, because it gives a doctor a direct timeline to work with instead of a vague feeling that something's just off. Here's the bigger picture worth holding on to after everything we've covered today. Amlodipine, Losartan, and Lisinopril remain genuinely effective, well-studied medications that protect long-term heart, kidney, and brain health for millions of people. Nothing in this video is meant to suggest otherwise. And no one should ever stop or change a blood pressure medication without guidance from their own doctor. That decision always belongs in a real conversation with the person who actually knows your full health history. What this video is really about is something simpler. The idea that a number looking good on a chart and a person genuinely feeling well in daily life should ideally be the same thing. And when they're not, that gap is worth investigating rather than quietly accepting. Swelling, a persistent cough, unexplained fatigue, dizziness on standing, a potassium level no one's checked in years, an interaction hiding in the medicine cabinet. None of these have to simply be absorbed into the broad, vague explanation of getting older. Sometimes they are exactly that. But sometimes they're a clear, fixable signal that a dose, a medication class, or a monitoring schedule needs a second look. The goal of any blood pressure treatment was never just to produce an impressive number at the doctor's office. It was always to help someone live a fuller, steadier, clearer version of their life, with enough energy to get through the afternoon, enough balance to move through the house confidently, and enough clarity to feel genuinely like themselves. When a medication supports that goal, it's doing exactly what it's supposed to do. When it quietly works against it, that's worth a conversation, not silent acceptance. If anything in this video struck a chord, whether it's something you've personally Experienced or something you've noticed in a parent or loved one? I'd really like to hear about it in the comments. Sharing what you've gone through might be exactly what helps someone else watching make sense of something they've been feeling but couldn't quite explain. And if this gave you a clearer way to think about blood pressure treatment, consider sharing it with someone who might need to hear it too. A parent, a grandparent, anyone managing one of these medications long term. Subscribing means you won't miss the next one. Take care of yourself, and I'll see you in the next video.